দেশ বিদেশ, জাতীয় আন্তর্জাতিক, রাজনীতি থেকে খেলা, শিক্ষা থেকে সংস্কৃতি, সব খবর পেতে চোখ রাখুন শুধুমাত্র নিউজ প্রাইমে। আমরা সত্যি লুকোই না, আমরা সত্যি দেখাই। সাবস্ক্রাইব আওয়ার চ্যানেল ফর ফার্দার আপডেটস।
নমস্কার, নিউজ প্রাইমে আপনাদের স্বাগত। আমি সঞ্জয় রয়েছি আপনাদের সাথে। এই মুহূর্তে আমরা রয়েছি কলকাতার একটি অভিজাত হোটেলে, যেখানে আজ মণিপাল গ্রুপ অফ হসপিটালসের উদ্যোগে এক আয়োজন করা হয়েছে নেফ্রোলজি এবং ইউরোলজির একটি ইউনিট লঞ্চ। এই মুহূর্তে আমার সঙ্গে রয়েছেন নন আদার দ্যান যিনি এই মণিপাল গ্রুপ অফ হসপিটালসের চেয়ারম্যান ডক্টর এইচ সুদর্শন বাল্লাল। কথা বলে নেব তার সাথে। Sir, first of all, you are cordially welcome to our channel News Prime.
Thank you very much. It's a pleasure to be here.
Sir, how do you see today's Manipal initiative regarding launching nephrology and urology unit?
This is a very interesting concept that we started almost 30 years ago when we started our first corporate hospital in Bangalore. And we said that we should always work as a group rather than as individuals. And even in the groups, it was very unusual for a surgeon and a physician to come together from a group. Usually there could be some physicians group, there could be some surgeons group. But Manipal Institute of Nephrology and Urology is where the surgeon and the medical person, that's the nephrologist, got together to form a unit. And that is quite an unusual thing. At least those days it was very unusual. But we always felt that without being a group, you cannot grow as much, you cannot have as much academic activities, and you certainly cannot leave a legacy. And fortunately for us, what started off as a two-member unit, one urologist, one nephrologist, now we have 50 doctors in there. We are one of the leading nephro-urology units in the country, and we take care of from, as I said, from the womb to the tomb. That is, we take care of young kids, we take care of adults, we take care of the elderly, and we have a proficiency in many subspecialties of nephrology and urology, like pediatric nephrology, interventional nephrology, state-of-the-art dialysis, robotic surgery, robotic transplantation, and difficult transplantation across blood groups, so on and so forth. We feel this could not have been achieved if we practice as individuals. Each one will do his bit or her bit, but as a group we have tremendous potential to grow, and we wanted to bring in that experiment to Kolkata. And we have many hospitals now in Kolkata, and we felt that that was a good way of starting to see if all our doctors here could work together. And fortunately for us, we have had multiple meetings this morning, and they seem very excited about it. So we do hope that we can replicate the success of Minu at Bangalore in Kolkata.
Sir, as we know that Manipal is carrying the legacy of treatment excellence. Now they are offering from chotus to geriatric nephrology. Sir, today when our life in very restless position due to rat race, how can we protect, prevent and detect ourselves to get rid of the hospitals?
You mentioned something that is quite important, that is about preventive care and primary care, which is very, very important. We should always focus on wellness rather than illness alone. I do believe at some point in the future, the hospitals will be very different. They'll only take care of the very sick patients who need an ICU or who need any kind of surgical procedures. I think by and large, rest of the care will be taken at home or outpatient clinics. So I think we are moving away from what you mentioned, that is very large hospitals, to more of outpatient ambulatory care, and the hospitals being reserved for the very critically ill and patients who need procedures. So I think preventive health care would play a very large role in preventing patients from getting into the hospitals. If you can control, and this should start from the womb and not very late in life. I think obesity, diabetes, hypertension, cancer, many of them are lifestyle diseases, and if you take care of your lifestyle, you may not end up in the hospital in the first place. So also I think clean drinking water, sanitation, vaccination, prenatal, postnatal care will prevent a large amount of admissions and morbidity in the general population.
Sir, would you want to share your message for today's auspicious day?
Well, I would like to congratulate our Kolkata unit on setting up this Manipal Institute of Nephrology and Urology, and I'm very thankful to our wonderful urology and nephrology doctors and the teams who are associated with them in coming up with this idea of setting up a MINU in Kolkata, that is Manipal Institute of Nephrology and Urology in Kolkata. I certainly hope this unit not only grows but is able to provide appropriate care to a large number of patients.
অর্থাৎ যদি কিডনির কোনো সমস্যা, কোনো ধরনের সিমটম, কোনো কিছু যদি আপনাদের মনে হয়, শাট ইউর আউজ এন্ড গো টু মণিপাল। নিউজ প্রাইমের জন্য সঞ্জয় সাহা, কলকাতা।